Hey, Dr. Adams here with Calibration Chiropractic and Functional Health. And as a chiropractor and as a clinical neurologist, I want to chat a little bit about a condition that's really common and not a lot of people really understand a lot about it until it happens to them. And that condition is benign paroxysmal positional vertigo, also known as BPPV for short, because it's just way easier to say. And what happens with BPPV is that you get dizziness. And the biggest hallmark of this number one cause of dizziness is that it's usually worse when you lay down. And so dizziness, it happens primarily when you lay down, like in bed, when you first go to bed, or when you wake up in the morning, is most likely BPPV. And so I wanted to chat a little bit about that, because it's not very well understood and it can be very scary and not many people know what to do about this. And going to the ER is not necessarily the best thing for this sometimes, because you can wait for long periods of time and some of the ER doctors may not have a solution for you for this. I've seen patients here in our area go to the ER for this, get diagnosed, and then get sent home to do the maneuver with a YouTube video. And so I wanted to cover this topic a little bit more in depth, so that you can understand it and make the appropriate decision for your health. That being said, dizziness can be a sign of very dangerous things like stroke. So if you are having any weakness in the body, speech changes, extreme head pain, then you do need to go to the ER. So with benign paroxysmal positional vertigo, what happens is that you have these little stones in your labyrinthine, which is an organ that senses rotation of the head. And you have these little stones, and these stones are positioned within these semicircular canals, and these semicircular canals detect movement, okay? And so that's not an actual depiction of semicircular canals. It's not perfect, but I'm doing this just to kind of explain it so that it makes sense to people. So you have these hair cells in here, and when you get a stone loose, the stones hit the hair cells, and that signals to the brain that there's movement. And if it's out of place, it's going to be hitting the hair cells, signaling to the brain that you are moving, when in fact you are not moving. And it's all because these stones have left an area here and gone to an area they should not be. The most common area that is in these semicircular canals is the posterior, is the most common one you're going to see. And that's why laying down is the number one indicator that this is the type of dizziness you have, because it is left, the front here got stuck in the back of the canal and then is hitting these hair cells, sending bad signals to your brain. And so one of the ways that we can determine if this is what you have going on, and one of the ways that you can as well, is if you're to lay on your back and you get dizzy and your eyes, if you can sense your eyes beating, that is one indication that this is most likely what you have. But if you sit up and it goes away pretty quickly, or if you're laying down and it goes away 15 to 30 seconds after you're laying down, then this is most likely what you have, and it is most likely in the posterior canal. And this can be treated with a very simple maneuver that's called an Epley maneuver, which we can perform here, and many vestibular physical therapists are well trained in this as well.